So we're interviewing today with Wayne Weston, one of the first candidates to sit the certification exam in family medicine back in 1969. And Wayne's had a long career in academic family medicine and family practice, and we're going to talk a bit about that as well. So welcome, Wayne.
Thank you.
So I selected you for an interview largely because your name shows up on the first list of 13 candidates to sit the certification exam back in 1969. But before we get into that, one of the things I'd like to hear you talk about is that you graduated in the 60s, went into family practice, and from what I understand of people entering practice at that time, there was a lot of pressure for people to take a specialist career, and that family medicine or general practice was seen as something on its decline and not very relevant anymore. And I'm curious what motivated you during your training to choose general practice rather than a specialty.
I'm not sure. I just remember always intending to be a family doctor. I decided to be a doctor when I was 9, after I almost died from appendicitis and ruptured and had bowel obstructions, had 3 surgeries within a couple of months. And then my mom thought doctors were next to God because they saved me. And I thought it would be better to be the doctor than the patient. And I had a good family doctor and looked up to him, and I guess I was copying him. But I'm not sure. I don't remember all that pressure that I keep reading about
Right.
to become a specialist.
So you graduated from University of Toronto.
Yeah.
And I do remember when I talked to you earlier, you mentioned that the only family physician you met as a teacher at the time was Reg Perkin, who taught an ethics course, nothing clinical.
Right.
So the pressure, I guess, might have come from just the role modeling, but the lack of role modeling would have been, I guess, one of the issues, but obviously it had no effect. What did you do after you graduated? Did you rotating internship or?
Yeah, I did a rotating internship at the Western Hospital.
Okay. And any family physicians interact with you at that time, or?
Don't remember any.
Okay, good.
But there was an opportunity to spend a week with a family doctor in a rural practice.
Okay.
I think it was right after med school, but I'm not sure exactly when it was, but I think that's when it was. So I spent a week with a family doctor in Wingham.
Okay. And enjoyed it, or?
I enjoyed it up to a point. He wasn't there very much.
I see.
He was planning to get married again. So he was busy off seeing his fiancée.
Oh, okay. Anecdotally, Alan Walsh, who you probably know, did something similar, and she was I think she actually ended up in the same practice that you ended up practicing in. And
In Tavistock.
yeah, and she was the only woman in the practice, so all the women came to see her while she was there. She did pap smears the whole time, and she thought, this is family practice? So I'm not sure. I'll have to talk to her about that. But you ended up in